Headache is one of the most common sites of pain in the body, which is defined as a pain in the head or upper part of the neck. It should be reminded that the signs and symptoms of headache or migraines are common subjects in different specialties such as psychiatry, otolaryngology, eye, orthopedics, heart, gynecology, dermatology and digestive system, and also general surgeons. Many patients complain about headache, and unfortunately, due to similar symptoms with allergy signs, some specialists consider it as sinusitis mistakenly. Around 90 to 95% of people experience headache once in their lifetime. 4% of patients who refer to their doctor and 1 to 2% of people who admitted in emergency ward in hospitals complain about severe headache. It seems that headache affects people in all age groups, children as well as adults. Most types of headaches are benign and resolve quickly, with no effect on quality of life. These headaches are not considered as life-threatening ones, while others are seriously life-threatening and dangerous. For the following symptoms, the patient should seek medical care immediately. Chronic headaches. Chronic headache or daily headache occurs 15 days or more a month for at least 3 months proven otherwise. This kind of headache can occur in different forms and conditions like tension and stressful situations. This kind of headaches mostly affects the back side of neck, shoulders or spine, along with toothache, feeling pain in jaw joint and eyes with sensitivity to light and sound. It should be noted that acute sinusitis also can cause headache, but chronic sinusitis may not cause chronic headache. Migraine. A migraine headache can cause intense throbbing or a pulsing sensation in one area of the head and is commonly accompanied by nausea, vomiting and extreme sensitivity to light and sound. It is estimated that about 17% of women and 7% of men suffer from migraine with different amount of pain and intensity, medium to severe. Migraine can disturb patients' daily life and can be one of the reasons to seek sick leave by the patient. Symptoms of migraine. Each person can have one or more signs of migraine. The healthcare professional should be aware of family history of migraine. Any familial feature of migraine should be noted. In some cases, the patient is suffering from migraine with no headache, but the other signs of migraine are presented. The amount of pain vary from mild to high intensity. In the most cases, the pain starts from half part of the head, but there are also so many cases with both sides of head affecting at the beginning. Migraine commonly affects temple, around the eyes, nose, forehead, back side of the head, neck, shoulders and also hands. In the most cases, the patient is complaining about a pulsing sensation. In some cases, the headache is accompanied with nausea, vomiting and feeling bitter. After that, intense light and sunlight could stimulate patients and cause headache. Otherwise, patient avoid light in times of headache. Patient prefer to sleep in calm and dark places, and they abhor crowded and noisy places. Most of times or always the patients have family history with migraine. First of all, patients should be asked about migraine history in sisters, mother and daughters, and then about men in family members like brothers, father and uncles. The headache usually starts in people younger than 4 years old. It is more common in women rather than men. The pain usually becomes milder 15 to 20 minutes after taking painkillers, and in the case of not using painkiller, headache continue up to 72 hours. Palliative. In many cases of weak migraines, resting in a calm and dark environment or sleeping or using hot water bags can help reduce the pain, and there is no need for pills. In cases where the person knows the factor of her headache, they have to avoid eating or doing it. In more severe case where person faces severe headaches once or twice in a month, which painkillers does not help, patients must use prevention method medicines for treatment to avoid headaches, which usually starts with small doses, and within 3 months the right dose for the patient will be known. The medicine must start with small doses, and if it wasn't enough, the dose will be increased. Please take note that if the patient takes the medicine on time and not change the timing by him herself, within a month we can find out that if the treatment was effective or no, and after the first month we can teach the treatment to the patient so they can control the headaches by themselves. Thank you for watching.